I'm sure that you heard about mammogram to detect breast cancer. But did you know that detecting breast cancer early can save lives and it can improve the outcomes of breast cancer patients? Hello everyone, my name is Rupen, and in today's video we will dive deep into the realm of breast cancer screening, showing who should consider doing a mammogram and how frequently they should consider doing this test. Before that, let's answer the question: what is breast cancer screening? Breast cancer screening is a proactive method. It's used by medical professionals to detect the breast cancer early in patients who don't have any symptoms. The primary tool that is used for this purpose, it's an X-ray machine known as mammogram. The objective of conducting a breast cancer screening is to identify the cancer when it's early stage, before it spread, before it develops, before it travels to other organs, before it metastasizes. And research has shown that when we identify cancer early and we treat it, this can also improve the survival, increase the survival from breast cancer. Who should get checked for breast cancer? So one common misconception about breast cancer screening is that age is the sole determining factor when it comes to breast cancer screening. That's not true. Different societies and organizations suggest different ages to start a screening, but taking into account other risk factors. For example, the American College of Radiology recommends early breast cancer screening for African American and Ashkenazi Jewish women. Generally speaking, between 40 to 49, it's very important to discuss with your family doctor or your general practitioner about your personal risk factors for breast cancer and if you should undergo mammogram. On the other hand, if for women between the ages of 50 to 74, it's very important to have regular mammograms and the interval changes. We will talk about it. But it's not only that. So there is a recent study that indicates that there is a rise in early onset breast cancer. Therefore, if you are at high risk of developing breast cancer, it is very important to begin screening even before the age of 40. It's very important to talk to your family doctor or general practitioner depending on the risk factor that you have. Also, if you want to learn more about the risk factors for breast cancer, you can watch my video here. So I created videos, I talk about the risk factors for breast cancer and what are the signs and symptoms for breast cancer to look for. We do mammogram around every 2 years. Again, the interval is very different. It depends on the person, depends on the risk factor, and we usually stop at the age of 74. But that being said, this does not apply to everyone. Let's take, for example, a woman, she's 74-year-old, but she's very healthy, she plays golf, and she doesn't have any other medical issues, right? So in this case, we will continue screening if we think that her lifespan is beyond 10 years and she's healthy. Because again, if we detect breast cancer early in this patient and we treat it, we can still prolong the survival of this person. So even at the age of 74, sometimes we might continue doing a screening. It really depends on the person themselves. So I said earlier that age, it's not only important factor when it comes to breast cancer screening. Ethnicity is very important. A recent study looked at breast cancer deaths in the United States from 2011 to 2020, and they found that the recommended age to begin breast cancer screening depends on the ethnicity. So the study looked at 400,000 female patients who died from breast cancer, and they revealed that Black females should start the screening at the age of 42. On the other hand, white females, they can start screening at the age of 51. On top of that, there is another research that indicated that breast cancer in African American females is often diagnosed at more advanced stage and also with a lower 5-year survival rate. These findings emphasizes the importance of considering ethnicity when determining the appropriate age for breast cancer screening. What are the downsides of getting checked for breast cancer? Well, there aren't that many downsides, but there are some downsides, like anything we do in medicine. Sometimes mammogram can give you a wrong positive results. That means that the mammogram test will tell the physician that there is a lesion that is suspicious for cancer, and the physician might go and do a biopsy and take a sample. And during that, the patient also will feel anxious, and the biopsy itself has its own complications. There is some likelihood of giving a false positive results. And this is especially true in women who are under the age of 50 because they have more dense breast tissue. Risk factor or like side effects that patients usually talk about or think about is radiation exposure. A mammogram, it's an X-ray machine. There is some level of radiation exposure, but when we compare the risk of radiation exposure to the benefit of detecting cancer early and treating it, the benefit outweighs the risk. And that's how we take decisions in medicine. So what happens during mammogram? Okay, so before the mammogram, you will be asked to undress from the waist and up, and you will put a hospital gown. Then each breast, one at a time, will be x-rayed twice. One from top, bottom, and the other from side to side. The radiologist will have a better look at the breast tissue itself. And also the technician or the nurse who's helping with the test, they will squeeze the breast tissue between two plates. Getting a mammogram can sometimes be uncomfortable. Like when I take my mom or I take my aunt, they really don't like the feeling. But again, this is a very short period of time. That being said, if your breast becomes sensitive during your menstrual period, so try to avoid doing the mammogram during that time. So what happens after a mammogram? So once you do the mammogram, it will be reviewed by a radiologist, and the radiologist, if sees any abnormal results, either they will call you or their assistant will call you, or they will send the results to the physician who ordered the test in the first place. But that being said, if you don't hear from the radiologist or your family doctor or the general practitioner or the physician who ordered the test, don't assume it's normal. It's very important to follow up on the mammogram results. I'm saying this because usually, like in North America, Canada, and the US, there are some cracks in the healthcare system where results and blood work can fall through. So it's very important to follow up on your blood work and the imaging results. What if it is abnormal? Okay, so don't worry. When it is abnormal, 9 out of 10 of the cases, abnormal mammogram turn to be nothing. But there is still 1 out of 10 cases that turn to be a cancer. So there are several options here your healthcare provider might do. It really depends on your risk factors and how suspicious the lesion they found on the mammogram is, right? So they might do another test, they might do an ultrasound, or they might do an MRI. The ultrasound is a machine that looks into the breast using sound waves. The MRI, it's a machine, it's an imaging machine that looks at the breast using magnetic fields. Or if the lesion is suspicious, they might also do a biopsy, which is taking a sample from the breast tissue and examining under the microscope. Again, there are multiple risk factors that play a role here, and the lesion characteristic itself, when it appears on the mammogram, it will determine what will be the next step. Or another option would be your healthcare provider might repeat the mammogram in 6 months if the lesion was not very suspicious for malignancy, and they will compare changes in the 6 months to see if there is any growth or any change in the lesion that was initially found. So what about doing a breast exam? The problem with the breast exam is that many experts now don't believe that the breast exam by the doctor or by the nurse is helpful for people who have no symptoms. So most lumps that are found by doctor who examine the breast are not actually cancer. Also, in medicine, if we don't have evidence, if we don't have data to back up our claims, we can't really make a claim. So studies have not found that doing both a breast exam and mammogram is better than doing a mammogram alone. Some people do breast exam by themselves, which I do encourage. Doing a breast exam by yourself, if there is anything suspicious, it's very important to talk to your doctor, but doctor is not something that they do. Okay, there is no harm from knowing your breast. And that brings me to the next point. It's very important to know your risk factors. Again, I created a video about breast cancer risk factors. You can check it out here. And also to know the normal contour of your breasts. Okay, and also to keep an eye and make sure you are cautious if there are any changes in the skin, in the nipple, retraction, redness in the skin, if there is any lump, if there is any mass, if there is any thickening of the skin. It's very important to talk to your healthcare provider or your doctor. Now the next question is like, how often should I do a mammogram? Again, it's not 100% clear about the best schedule to do a mammogram, as I said earlier, but usually the recommendation is to do a mammogram every 2 years. Okay, that's for most people. Again, the scheduling of the mammogram, it really depends on multiple risk factors and you as a person as well. But that being said, it's very important to be consistent with doing the mammograms. And that brings me to the next point. Because doing mammograms on a regular interval helps us also to examine the breast density. What is breast density? Okay, so the breast density refers to how crowded the breast tissue is. As you know, women as they get older, their breast becomes smaller and it atrophies, okay, becomes less dense. A recent study published in JAMA Oncology revealed that while breast density tends to decrease with age, but the slower rate of decline in the breast precedes the diagnosis of breast cancer. So researchers at Washington University in St. Louis, they conducted a 10-year analysis of breast density. They brought 10,000 women and they followed those 10,000 women over 10 years. And they looked at their breast density. Out of these 10,000 women, around 289 women later were diagnosed with breast cancer. The researchers looked at those 289 women and they compared them to the 658 women who did not develop breast cancer. They noticed that the women who had breast cancer, they had a slower decline in the density of the breast. Their breast was more dense. So it's not only the mammogram at a specific given time that gives us also an idea about having a breast cancer, but the change of the density of the breast tissue over time help us to determine the risk of developing breast cancer in the future. That being said, this is still fresh study. It's not yet in the guidelines. So in conclusion, breast cancer screening through mammogram is very important because detecting breast cancer early, it can save lives. It's very important to understand that age is not only risk factor for developing breast cancer. There are other risk factors like ethnicity, family history, BRCA gene, as I said earlier. So it's very important to take the individual risk factors into account and talk to your healthcare provider or family doctor. And it's very important to detect breast cancer early because detecting breast cancer early saves lives. And by staying proactive and maintaining a regular screening appointment, we can significantly reduce the mortality that comes from breast cancer. I hope this video helped you or help your beloved one. Stay healthy, and I will see you in the next video.